Welcome to the weekly Dear Dr. Mao. Today I would like to talk about the role of acupuncture in cancer recovery. Later on in the episode, I will share with you acupressure points that you can apply to yourself, family members, or friends to provide relief from common side effects while undergoing chemotherapy and radiation. First, allow me to share my background of how I came to integrative oncology. My first clinical experience with cancer was during my postgraduate residency at Zhongshan Hospital in China, the teaching hospital of Shanghai Medical University. It was there that I saw firsthand that patients receiving treatment with chemotherapy along with traditional Chinese medicine recovered remarkably well, compared with those who received chemotherapy alone. The energy was better, and their blood chemistry improved quickly, which convinced me that an integrative approach was the future for providing high-quality cancer care. When I returned to Los Angeles in the mid-80s, I began working closely with oncologists, scheduling my patients' acupuncture treatments to coincide with their radiation and chemotherapy. I administered herbs to boost white and red blood cell production and created personalized nutrition plans that supported their energy and digestive functions. In addition, I taught my patients Qigong, meditation, and visualization to calm their anxiety and activate their positive, innate power of healing. I also listened carefully to what each of my patients had to say and related to them as a person and not as their disease. As a result, I was able to see that patients who were treated with an integrative approach using the best of both Eastern and Western medicine had a dramatic recovery and improvement in their quality of life. I was touched to see that by combining Eastern and Western medical traditions, it was possible to introduce humanity into the treatment of cancer to help my patients find inner peace and restore their faith in life. I also bore witness to the power of the diagnosis of cancer as an agent of change. It often caused fundamental shifts in my patients' perspective about their life and their relationship with others, forcing them to view their lives in a completely new way. One of the tools of these positive shifts came from patients' experience of acupuncture treatments. For all of our cancer patients, their weekly or twice-weekly acupuncture sessions are what they looked forward to. It's what sustained and kept them on track with their chemotherapy and radiation treatments. The best part of acupuncture is that it's free of side effects and directly contributes to increased sense of well-being. That's what every cancer patient needs. The feeling that normal can be experienced even while living and coping with a disease that feels so frightening is of the utmost importance. It gives patients a lifeline and hope to fight on, to not just survive, but to thrive. Acupuncture has proven to be effective at alleviating cancer symptoms and cancer treatment side effects. It is an evidence-based treatment method used by billions of people worldwide. Besides being an essential adjuvant to cancer treatments, acupuncture has also been found to help in other ways. For example, it helps restore and balance production of serotonin, dopamine, and endorphins. This helps lower anxiety and depression while elevating mood, especially for cancer patients as well as cancer survivors seeking to prevent recurrence. If you're able to receive acupuncture treatments from an experienced and licensed professional acupuncturist, I highly recommend that you do so immediately in order to access the benefits it can offer you. If you're not able to access treatments, you can try acupressure at home. The use of acupressure is based on the same acupuncture meridian theory. The theory is that when an acupoint is stimulated along certain meridians, it activates the body's innate self-healing and self-relief response. Meridians are energy pathways that transport qi, or life force, throughout the body. A review of 23 studies published in the Journal of Pain and Symptom Management found that a daily 9-minute acupressure treatment given prior to chemotherapy substantially decreased nausea and vomiting. Now here's the first acupoint for relief of nausea. Simply apply steady pressure for about 1 to 2 minutes with your thumb on the acupoint P6 or Neiguan, it's known as in Chinese, located about 2 inches below the crease of the wrist on either arm. Relax for 1 minute and then repeat 3 times. You will find that in between two tendons that become pronounced when making a fist. So here you go, right here. The next acupoint for energy boost is Li10 or Sosanli in Chinese, located approximately 3 inches below the end of the elbow crease on the muscle. Apply steady pressure with your thumb for about 1 to 2 minutes. Relax for 1 minute and repeat 3 times. The final acupoint Li4 or Hegu for constipation and pain is located about 1 inch from the web between your thumb and index finger on the edge of the second metacarpal bone that's attached to the index finger. When you press down, you'll feel a tenderness. Again, apply steady pressure with your thumb for about 1 to 2 minutes. Relax for 1 minute and repeat 3 times. To learn more about how to use acupressure for self-healing and relief of symptoms in the comforts of your home, I highly recommend that you download my ebook, Secrets of Longevity Acupressure Healing. You can do so from taostar.com. That's spelled T-A-O star.com. Also read my book, Live Long, Live Strong, on using the best of East and West to help you recover from cancer. I hope you find the information from today's episode helpful for you and your loved ones. Tune in next week when I'll be exploring the healing powers of mind and energy in cancer recovery. Until then, live long, live strong, and live happy.